lot of the athletes that I'm seeing right now, I have a big portion of my athletes that are mixed martial arts. And most of them are getting injured either training for competition or in competition. We are also moving into competition season, so people are trying to get better before the next competition, which may be 2 or 3 weeks down the road. Kind of my criteria to getting them back on the mat is they're at 80-85% of where they want to be. Typically, people are leaving me when they're about 90%. If you go in for an orthopedic injury, you're talking probably 12, 15, 20 visits. My average episode of care is around 6 visits. Part of that has to do with the fact, number one, is getting to the right diagnosis. And that's where 25 years of clinical experience helps a lot, and is really being able to differentiate what that diagnosis is, being able to provide the science and the technology. So a lot of things that I use a class 4 laser as an example. So it helps me to accelerate that healing process. And then also understanding what the tissue tolerances are. Again, from doing this for 25 years, what allows me to do is really understand how I can push somebody to a little bit higher level and leverage the technologies that I have. Whether it's a class 4 laser, whether it's just instructing them in ice, educating them about inflammation control, and using things like Normatec, red light therapy, things like that, which really helps to accelerate that process.